Antibiotic resistance is an issue that's becoming more and more urgent for patients and for GPs. And we have to find new ways of being more careful with the antibiotics that we use. Now, when you have an infection, you usually try to hold off as long as you can, not going to the GP and not visiting your doctor. But after a while, your pain gets too much and you're just getting too uncomfortable, and maybe you need to go to your GP. And he or she may prescribe an antibiotic. But because you're at the height of your pain, you might think that the antibiotic you take in the next coming days just will ease the pain and will be your treatment. But what we are wondering is whether it's actually the natural cause of the infection and you might not have needed the antibiotic at all, that you were already on the course of improvement. So what we want to do for this trial in the Primary Care Research Network is we want to have a look whether patients might be able to stay away from the antibiotics, and we would like to do that with urinary tract infections. Now, these are very common infections in women. And what we are doing is we're making a number of boxes where half of the boxes will have the antibiotic treatment in them, and the other half will have a painkiller. And when a woman goes to the doctor with a urinary tract infection, the doctor may ask whether they might be interested in joining our trial. And then if she does, she will get a box with the treatment, but nor the doctor nor the patient will know what's in the box. And in the days after, we will then contact the woman and find out how she's getting on and if she's actually seeing any improvement. And at the end of the trial, we will be able to see whether it was the antibiotic that cured the woman or whether it was actually just as good taking a painkiller for the symptoms. And this is the way we kind of hope that we find better treatments to deal with infections without the use of antibiotics.